drew a mope brena mo tnase moje brena mo ne ye chedwumadie no because de ebeka ni nyina dodo na afri mo ho ebia de ebeka nyina fa ye nyina ye hontie da mase bra so se de nyansapo no bremo mo amontumi enchi wo TV no mesre mo sa wo Facebook nko ade ano wa join ne na mo wo YouTube no so nyina no betimi a join na wa hwe live. Now, before some about me nyansapo me ne so no say dan say ya mini nyansapo bi wo ho kakra. So obekaya February, yeah, the 2 days started the state of Ghana's hospitals. Samokaya. Yeah, the 2 days share and yeah title ne say sick hospitals. You call Kolebu Teaching Hospital. You call Sunyane Government Hospital. You call Takrade. You call Koforidua. And you call Kumase Kolebu. And so you sign call you call Konfanoche. There's 5-6 hospitals. And you call smaller ones. And you need doctor for din komo. Me run it down and yama omusu omuhia omudi juma omunyabi, including cotton wool, any AEDs, fridge omunibi. You count the number of beds. I work room ha 10,000 sick patients. Omoye entitled to one bed. 10,000 patients biano. Now it's a patients to bed ratio no. Ghana are buying hospital beds are buying at room ha for 35 million people no. 10,000 to 15,000 beds anyway. Ya can na and my health sector no. Doctor for need to say sick hospitals are welcome sick patients. And I say sick people. Dear see what Tamale Teaching Hospital na new. So Osha no ameshe entire nyansapo ye no ho ye ne doctor for nkomo. Na ye hold the brief e dia ma doctor for ni so mu free Ghana. Now mutu kwan ko baby especially UK. There is a research approve, and I told you the statement in the House of Commons our UK omoka say Ghanaian doctors rank higher to all the African doctors omo ho. Omo bo Ghanaian doctors abaso so omo highly sought after our UK, including our nurses. Intergested doctor for mo hanomabon. That is established, and we all know said they are some of the best in the world. And Ghana. Now, apart from that, and so, Doctor for Ghana, my year akuma surgery, or my year surgery, baby, first of its kind, Africa and West Africa. Say, given the needed supports and the environment, omoye magic because he said the omoye no magic no omoye Doctor for be bri omoye magic okruma. Me mako hu nurse obi awo ye na wie na nurse ne san twe oxygen or oxygen tank you said there no cylinder no and they call another hospital because e bi ni ho akura no bonebo a day old means our kra na oxygen si akura ne so na or cylinder no yes our bruche but omo yes ani mani nyina enti e be kan the state of our hospitals and no na ye health minister kom na mita kando a call unannounced visit at Tamale Teaching Hospital. A call for fracas by Odu Hona patients be a ne family a report to a diamano or confront to doctor no. No oshe mask. Na doctor no so and then a casa quite be so minister na ampe I ma camera because on call unannounced visit the media forced to the chi into the state of the hospital. And here dana ye and the admonition minister and say uncle such unannounced visits. Because I feel waba. Even though some health committees or parliament, unfamiliarizing with the conditions in it properly because a bro ranking member our committee of health and so on or call kolebu or mama nengram abra ye ka say escalator say wo hono o man ti mama nengram enti say we minister dey obenya access to documents obetima request for niam bi ahwem ampa dey kan no bi wo koi but dey kosi wo hono I don't think say a good. Utie minister no clearly he didn't like the way Dr. Nene Kasai. That was the starting point of the confrontation. And a doctor also say also church and insemu. But before say camera never babonten na ye nim asema minister na kanche ne they started and said the minister didn't like how he was spoken to because he thought say no ordinary Ghanaian be and say yan commoners ni bi. Ena yaba ena yekobusa anka doctor no sa na obekasa ne ho ana. Obviously the minister didn't like it. That is where the conversation started. We don't have the privilege. We were not privy to the discussions prior to what came out in the public. But Anopa Ghana Medical Association for the Krata Abeto Abonte almost support to Tamale Teaching Hospital for say no craning ya mianimni omo nya adwuma biem omo de omo tu so go form and just say nipa omo ho omo hwe omo no but omo nya adwuma bia with the exception of emergency situations bia omo nya hwe na omo listed niam bia omo epe me pacho ma men run through sesia omo so omo pe public apology from the minister. After that no omo pese omo bo modern say omo betimi anya saa niam ye omo listed nyina ansa na omo akọ back to work. Na eniema no so eniema ye bebo so no bi omo chese one, constant flow of water through the taps for clinical work. 2, stable electricity supply in the hospital. 3, constant supply of oxygen. 4, provision of consumable items such as gloves, gauze, and gas, and omatro cotton, face masks, omo cannula. There's a bought ni pansan muno, and a face masks, omo pe syringes, omo pe disinfectant, omo pe glycometer strips, a plaster, constant supply of reagents to ensure continuous availability of essential lab tests within the hospital. Well, mamenko next one so. Afen so omo pe 100 continuous vital signs monitoring devices for all high dependency units in the hospital. Almost 4 ventilators at the accident and emergency department. Almost 4 ventilators at our intensive care unit. Almost 2 ventilators at our pediatric emergency ward. Almost 2 ventilators at the neonatal. Nese Niku Hono. Almost 2 ventilators at the maternal intensive care. 2 transport ventilators. 2 transport incubators at the obstetrics and gynecology department. Almost service and repair 1,000-liter autoclave machines. We mo the omo technical terms. Afe omo chese in the medium term. Na say the mababo so in here urgently. In the medium, omo pe MRI scan machine that does not use helium. Omo pe a CT scan machine that has an infusion pump. Omo pe mammography machine. Omo pe when you fluoroscopy machine. Fluoroscopy machine. Omo pe a CM machine at the main theater. Omope ABG machines in all intensive care units of the hospital and 1 at the accident and emergency. Omope 2 mobile X-ray machines. 5. Omope almost the doctors, at the Tamale Teaching Hospital. They will continue to engage management to ensure that the aforementioned in points 3 and 4 are available for healthcare delivery. We shall advise ourselves if there is a failure to achieve that. Now, no credit nyame a dana ye doctor for a how mukomune ye hospitals no. Obia otie ye bia se untie ya eda ye Facebook page any ye Facebook and YouTube. Kwanya ye fa so a ye bo Ghana doctor for abaso so mo ye magic. Ba media no pay me Tamale Teaching Hospital mpanyifo na nya adwene. 1. Asono me no ko a eye ewura na ho ne bre. Krata na Ghana Medical Association di abana memene omo enya adwene. Se minister no na ewo kwan bi anka obetimi afa so a ebia ewuo na esiye no nka obefre doctor na kodem without the media a question no. And a doctor no so kasa no so because we are den wako school saying ade e wo krum ha no. Wona oye doctor but obi obeba be minister no the minister. Enti the respecter o deserve say we the man as a minister no na o de amano. On say nipa ne bebre hu ne say ebi mu hu ebi mu chen omo. Say we mu de ebebu omo ba we de yemu no. On say eyesa na akoba say minister no obu nanim tia. We a doctor fine, but obia ye question obia on adwumam. And there is no better person to question a doctor than a minister of health. There's no better person to question a minister. The forum for the questioning, I find it wrong. The camera, any the drama, no, I find it wrong because it involves death. Yes, now who endanger doctors in a life, and I say who encourage a man for the nipa bahona generally nipa ni free mukra. Yebeka say doctor for no sa no motie minister nipa enti no dear I didn't like it. But it doesn't mean that the minister cannot question a doctor. There is no better person to question. Obi o ye adwuma organa bia ye question no. Obi o ye adwuma organa bia bi sia ye question no. Enti se kasa no na anko yi a I think say e ho no ano they could have also apologized to the minister. No so apologize say dan say ye be jai nipa omo yare wo northern sector na say ye di on beba ho nyina no because of adi we no ye say ye nhwe obi abiem. No. Me minim say doctors are some of the more doctors da no. Proper doctors are some of the soft spoken people in any profession. Doctor for my paper. Obi nka kroma ho penipe also mo ko a friend is a strike and a doctor for. But adwuma no a passion no mudi room. They are some of the soft spoken people who be more any profession. Utmus attention and see now doctor ye calm because per their training. And I was very surprised at what happened there. And both of them, in a way, minister and the forum and the cameras didn't help because but there is no better person to question a doctor than a minister of health. Said yes, because me big question is say, any amount malice in I be ni ho. That is the big question. Any amount malice in I be ni ho. That the Minister of Health, as a matter of urgency, or can be or why me depa, or say, from now, more moon chaya buying. Hospital be auka utieska. Utia and con cry straight to Yajin Hospital. That is their internally generated funds. And some are buying some more subventions near the grants on Benya. Sasi can omodi ya de inti and suma. Water. The minister was questioning saying Timun Timin Tonsuo and would thank him because Dr. Fordy baby or more private hospitals. Ayo Mudia. May assure so a corner pipe ma. They will find a way to buy water. On say try and buy no. It should not apply to hospital, especially on basic items. And like I'm saying, this is not to say it's a doctor for Nyadi because already ye program ha. Yeni omu nyina di nkoma across the country atremo the state omu ye adwuma wom. But the minister has come there and baby to say toilets in Suomba sabi ejanai bia yatum ewo Tamale hospital in Suom flow and obisa sentimuntimi mfa muntimi giska 200 cedis enkoto ensuo emma mehoro adwai ho yatum ye twan aban from on but obi ba ho utueska. Sometimes I was saying so nti enema bi ye basic there. I don't believe that ensuo cotton ye try and buy man to be because obi a pray nya cotton to so. Nti minister na some kind say free na ekwe no internally generated funds no mo be create portion bi a hospital no betimi de monsa bom na mayi toto nema bi oho. Minim de nti o se so Tamale sika nyina ban kran. Na mo pensu a ya tra minim their friend decentralization no minim ba bi adu including a hospital nipa da ho you say ye ni ventilator ye ni way just say no ye koto gloves just ya tra ban kran nti say nsuo ma e wo hospital e just somebody has been irresponsible there. I'm not sure that any leader will wait say otwanyama abanyama nsuo wo Tamale hospital. As for that one, there is no way a Metias Yediama any leader our way CEO Tamale Hospital. No. Leader, they will you solve problems, the ones that you can available. Say in so Mao Hospital, why just see a train buying. Until be our yarida why here in so dia bibino in so ma. Yen na yen kwa fasotia. Minimo bi obetima CEO bi obefa IGF no dia two borehole. Our Tamale Teaching Hospital. And as I'm betting my truck rat akradiama, NGO be or mobetu boho, diamat intinsu mam yato, a giant Tamale Hospital, a giant. And you might be said, your dream, I just said there is a leadership crisis. right from the ministry top to the CEO. And ye beji sikari nyina dia konkran. And your hospital in condition there, I will not belabor the point again. My beka, me see you spend 2 days. I can want them speaking to doctors on this same show. And son idea we kosi. Nti kwabna minta kando. I believe that sad decision say yenjai IGF no, emma doctor for ne obi oye CEO no, because already they would come and account to the Public Accounts Committee. Ade omunye ye no muntumi nka so maye. Na obeko kolebu konfanoche o flashe yare na wo yare a wo di akwaje se niam e wo ho nyina wo yare sabi o ko ajare a ensuo ma adanya pipe ma nti yeni alternative source of water supply e wa bra se yenya ye fie ene ye private facility there, we can think of a solution. Do we have to wait from Accra to buy water for Tamale Teaching Hospital? No. Nemo Malis teachers omuni bi dada. Abaya kwa abaya ba omuni bi. Enti se nemo ka se mo anya niema we ya mo nya adwuma bi ma e kire se the minister ne be na mo bo afu but nka mo ye okay. Do you get my point? Matna ho ade ye adwuma. Senka all of a sudden one day mo sorry and am so ye nkwa adwuma biem. Because ye ni ventilator, ye ni niema matwetwe nyina. Na amanfo hu se mo ya but say no, mo amanfo hu se mo ye comfortable working in that environment without water, without ventilator, without these basic items such as gloves. Mo ye okay. There's no running water. There is no stable power supply. Hospitals were Ghana. Yetimi dum kania. Ya ye adwuma 60-70-year-old hospital. Omu ni plant. But sir, Dr. Nina no, obi na hospital a onim se o se top plant near this ho. Enti sa ideas no CEO for no mo bad omu ni bi. Say internally generated fund obi obeba ha bi aginiska, bibi ebe ye bi ayegiska. Enti entumi fa bi ensolve sa ba bi ye important na nya small plant bi ebe supply, ba bi ye dum light ebe ha adwen ana. Because the amam ne ye hu ne say doctor ni die. Sabi omuntai nye mistakes abaso ye mistake nipa na ahwe ne nkwa ye yete ye kasa ne anofoma oh ye very sorry ne asan atwe asan ye ne ye kro no but doctor they won't mean retract death, won't mean retract injury ne harm. Enti ye bomo abaso or conditions na moye no mama koye ne say we ni antagony bi na mo be create because what na condition we ya mu na mo de ye adwuma. And I'm more putupru. But minister neba unannounced visitor BBC wo ho. He didn't like the way I'm doctor and kasache. They united and say, is that the way you are even responding to me, a minister? And you're commoner. I don't yet say you anti question of the man. Camera no medical can say it is not proper that you question doctor no in the full glare. And a doctor no so anka say yeah, minister ne buofu. But say so ma hospital gloves ni ho ne yete ho. Ma dear Hamid say no affect yeba hospital no. And your minister no na affecting obekwa breach akohwe ne ho. Nti ade na yebet na ho amana do that level. I don't believe that we should be doing ourselves that disservice. Yankwa adwuma because of sadie na asie no. Because our mind would to me say we see you na dia. Ni to me no exercise. Minim die omope apology ne for. Minim say like a friend is saying camera na edisi doctor and so question no question there you cannot say it's a minister of health cannot question a doctor. There's no better person, but the forum was wrong. The cameras and the theatrics they were wrong. Fine. And be a doctor and so kasa che minister na yet say ya or say I fear a doctor and so admission say I was trying to explain to you say no so nya munyina mu yempanyim for turn the situation around. Go into the room, sit down, resolve matters. Now, health in the agrono. Among for the people there, they don't care what the minister is saying. Obi okra wonte the SCA, Nebana Ayare or the neighbor no pay say, you may become minister. Minister said that is what doctors at the Tamale Teaching Hospital and Ghana Medical Association mope. Because matana hwa besi sabri. And we should turn this situation around positively. Na yemfan and revamp the state of our sick hospital. Yeah, they can't want some abre. And we have commended the doctors. And this is not the time, say, yeah, cause strike about affecting the more Tamale. If you have been staying with this condition, and mama minister ne de me say and ye bu afunti afide ye eje na na me ne wo hai wo bada bia obekasa wo headphone ni wo we okay bibia badakru bia CEO ba se na wan kasa yi now ene me bu afu wo kra uni headphone na mete ho na wo te ho ye dai e che say yeah wo twan ama bibia si na wo de aye revenge and revenge and so the ultimate sufferers the masses eno na mementi ase no
oba yami sure me da se ena lo pase mo yaka na baby amenso mensa da no nya adwene se obeka se
yeah
minister no conversation anka wo se eye kokoma na se camera ho no ano
oh and so what's it
between public servant and a civil servant pertaining to our health
yes
citizenry ye die apomudi en fe ni agro enye tuma bia hu se eba bonte a ebi asensei eba bonte a se de omukeka ya komu hia equipment bebre o malesi ka hu komudi na bank Ghana fo nyina ate na bibia koye kama enfunso bia ni ho
so question the public
enfunso bia ni ho
oh anya
me hu se enfunso
question na me can say in the public no the man no me stroke kakra na pertaining the death of a patient eba ewu ho asema ene obetima question na wa set probe
enye pathology ho nsem na obisa say the causes be babonte
o say the obetima man na ye ho ne
processes leading to
the be patch ne say yes a doctor for no next time obi di patient be ko ho no say doctor for bo modern kra na owu a because this is questioning mo na mama na wu suggestive of mo na mama na wu abra ye nye report bia no e da manfo trim say Tamale hospital there say eno na me but also say no ensu emma ene sa de man there I like it on camera
ni nyina mpo no hwese mo laki no ma we nyina na mo ntuanka na chese ekwa bi so mpeso o mo chese ye ni we nti no wu ye o ye ni akadenti no wu ye
that is what they are communicating
na chese ma mo ayen se mo hia no ma we nyina na mbeka ye sentrofo dia na ugu so amanfo beka na bibia koye kama enko bi ntumi blemu say ni say because so bi ka cho say koye aduane ma mini na so de nsuo nko ama na de nsuo nko abre na enka no ano no wonu so asefa na we for na we na so ama ho akade a ade na umisa
wo na we chef una we expert in cooking
so ade na umisa no de akwaso hospitals ye hu bio na tola bi a essential service wo mfom so ka ne kase ha adwen enti na ntumi nka empo de papa bufure na free doctors from nurses ne ade aso ni ha adwen enti do mo aye ne de ekwa bi so right na the wrong time samu hia kade na ntumi nka normally say nyina bi kra long term any immediate you mo hia bie ade na man kan tempereko some minister entwa na mo ha na nkotu entwa ka se mimpo na mo yemi sei na say common na bi anka mede oba enoma bi wa yehu a some minister pe ni say ya yesi danfo nye na baafo danfo anye na baafo so ntimi de minister no me ne ya dwepa and a set visits no eye more
ehia
institutions ahodo nyina sanoma we nyina enko ho
and some of the important things that men do no etwa no mesro doctor foni bi so e kanokre say machines ni bi ho a asay ho na omo enye in terms of mbeye no omo obi o private hospitals ntuba ne refer ebwa kolebu ni CT scan
now say oba ko private hospitals be to say teaching hospitals machines wo ho no government dey bi ne ho minim dey ntia ba ne trauma iwura sa situations mu ana fe ye ka se we CEO of a hospital enya pa ne ho CEO na wo ko wo we administrative manager doctor say dey omo ho omo bia health ni e wo ho ana wo ehwe entutue bere bebo ma ayarehwe akoso yi se agigi sika no na se gise de aba enkran ansa obi bedi bia obetumi the state se bia se ne nyai no acheso obedi enye de be adwuma ho na be ma accountability enye adwuma ho enti kamo mo kwa mo sa de aba be pe bia ka ho tell na mo fa hyase wo ho na de mbo hia ka ho no mo nkonta paperwork bia ya adwuma obi mblemu mo
auditors ba ho
eba ho
enti ade ne ye betra Tamale ye betra Sunyane na nipa na oda hospital anu wo Sunyane ana oda hospital anu odua ankwanta oye bibia wi ana oye oda hospital
bank
this what is sikana bank na ope glover what sure the bank
a day.
Yes, and be
it's a administrative process now say wrong. I was saying
very wrong.
And I can who said has the account will be ariano said you hear a mantama it me manu
who so to me yes
so that was a bank answer a brain can decentralize ya can't bre second never be on can have until the above be able buano a mamu be be a bepum will be able buano no be able to make easy access see I'm trying to na so see me see you and I say the administrative manager be hospital be na so fast why mo me any say there be infrastructure so nipa cry enkwa yemfa ni agro
there be
the course will be ahwe no kwakofo wi aba nyina yemfa so bon so ma administrators ne bi wo mo amwaye say ye beka say nkuntabu anti na no obedi sika na de otraba no ni ente so ansa na otraba enti ebesro
okay
ye besro yare de ye yade a yemfa ni nipa kwa yemfa ni agro
me de me support unannounced visit no
papa
the last February year program that was what I was saying say minister no omonwuram onfa camera nkona ye nkohwe adwaye a mote ho ene ye yi ofiri ho ne ye de obi ba ontumi anu wano so resign say mentumi ma ye mfa nsuo ma
ye kan ho se adwaye pa na che se toilet ho nya nsuo nko ti ho nya tututu
yatum ene minister bisa na matum mpo amontumi mfa na ye scrabble ho Johnson sebi Johnson ma Johnson nyina gugu ho according to minister no say na se usi nsuo mantum atum nti obi ba ha wontumi nya ne ho ye o me se adan o se nsuo ma no se na nsuo mampo amontumi nto nsuo ntwitwi na montum hospital awo kwa kofa
previous day ni scam benya betu atoma na broso the previous day scam nyai aje fa munya no ho
udi nipa to ade anu okrum ha na say akatua no okoje adie de aka bia ye nyame inshallah ofa nipa obekono na officer panyite no onam akomai afu no oteta no de awuram wode ne ka akowuram no afro akotena no bia ekona buy ne nam nye no ne service o se de okoto adwuma bia no na a basic thing as lavatory untumi manage a say you are not fit to serve there no kra no untumi ntonsuo 100 cedis e ma ye mfa ntwitwi ho a
essential needed to say
essential enka sa koto CT scan ana koto bibia nti sa wo abontena it is not the doctors and obi so omunya omodwuma yi o ba wo ye doctor ni na wa ba adwuma wo de ne se obese nkwa machines a wo hia na equipment ni logistics na ni ho a go through the CEO na wo ko CEO yi hoi adwaye mpo a sebe ye kwakwa ye hu ye nsuo ma na je na je so obetima to CT scan ama ya de say adwuma isu ahye Professor Frimpong Boatensa otumi si cardio center ye man kolebu CEO obi si cardio center obi so ntimi hwe adwaye a that's a difference
papa ne ye ya to lesson na Germany wo mo ye sen ko naturalize na ewiase nyina nipa 4 yakoma yi na oka ho nipa 4 pe no Obama na katua krono de bi support e sad na katua e big ekem
I don't understand
ya nyina ye
kom na minta akando memma waba mu mu ebia mi opanyi bia mistake memu mom de me hu ne say questioning the of the death and you questioning in public no the death of somebody ebia doctor no e ho no ye nyanye coroner's bia wo mu ne hu say ono ne eku no ana say ne negligence ne ho no na ya court ne ya set probe e ba bonti ana ya publish it but ayeda no wu ye e wo public ne de na me ma dwen yem say sa na obusa no dia minimum response I question ademano but in the response no na enye no na can ye call hospital a media doctor for normally they are very soft spoken and
professional we no say that ye course ho o mo kasa boko pa but it's because kasa communication a part of healing you know
a part of almost omodwuma
ma tia pontem
na
o kasa mo akoma to yem yi boko ni ade to pressure say bibia kama na yemfa don kan krampo no na ho to ba
entina make say menim de be ma escalate adrusa but e bi nso ano ya bi so ano ya e bi eno na wa hu say enze minta kan do no so oba hu si kra so e minister no asan bo so okọ no wa hye no ma enti o utimi se uja fukotu fon ma no say for asem kodo
into be here be say minister na
wakawie but abufo de baba me nyo mo nya adwen
Now, one very important thing I will say, who's an items no malice. Doctors, hospitals are going to have some heavy. Could be a fine demon to see any to one among minister Mahas. Now it will be like I said, near New Winter and will be we. Or by who's a Samu no mother bray. But the basic thing is a Omotia sends a minister no buy 2 months. Yes, I'm what the idea command on one toy. Enti enyo no na modi be revenge. Yet home from 1960. Ene bi ni ho. Nti enya asem asi no na ma hu say Dr. France Rebo Okoku e de krata at Ghana Medical Association. Momma patients na omo ho no. O de mote ho a mo ye comfortable up to now no. Mom manage na mom fanhwe. Giving that ultimatum say yen san kan yen adwuma. Enti munum say ehia mo dada na mo nka. Eno no me ka no say mo free abonte na mo ye press conference. Say mo hia ne ma we. And I'm more engaging minister now. That is different. But one day, Panama sorry say, Minister Abeka said, me say there is no better person to question a medical professional than a health minister. Why be him? President? Debbie. Minister Nadia no ye what in office no frame or bahon will be who ye. Emily Professor Mestias will ye be. Port. Boa ye no sana corruption e kwaso ho. Sika ye nyua. O mani nyanka wo say yenya na individuals edi enema reforms e course wo port nti unannounced visit ni de enya na ye se kwa me groma wo ho anu aba office woni ho e be bot 12 na GBC announce say beje letter na kofie sana Ghana for pe o 12 ye se beje media me sakin say no ye nsake wo say wo ye doctor na asake wo say men practice you na manfo nti ase CEO na wo ye no to ye doctor wo betima kwa e wa adwuma Ghana for ade aye pe no salary no oje aye ne de upeso ye ho adwuma oba na bi gbe nkoyi asake no na no so de be beto minister ne so because o sake no or be request bi wo ho ama wo so provide because one provide a wo be sake ho nti say anti ase say minister e kono wo question sa de ma ene de biem ne epe kosi enkosi kwada mutete niam we ho saa mo ye adwuma Minister be question ye dia mo say on for apology mranye sa 1 to 20 ma we ama ya ye nya adwuma patane so na mo de mote ho amoye ene mini nyansa pono kra question me no na ma mfa to 10 minutes bi mfa we no omo nso mo ma mesesia